I said, let's go. We're taking him to the emergency room right now.
This is like the worst thing that could have ever happened to me, and it just happened.
The first thing I thought was, why did I go blind?
How much longer am I going to have my sister?
Next, 3 medical mysteries that defied the experts. Colin Campbell is just 12 weeks old when his breathing problems begin. Doctors are baffled, and within months, little Colin's life hangs by a thread.
He's not getting better, he's getting worse. And now they don't know what's wrong.
Laura McCann is a successful business owner and single mother of 2 until a debilitating and embarrassing condition takes control of her life.
I want to go to the doctor, and I want to get somebody to help me, but I can't.
And Cuetta Davis was on her way to getting a college degree when she is stricken with crippling pain that no one can explain.
I just had that uncertainty as to whether or not I would live.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. When John and Mary Campbell married in the summer of 1996, they were told Mary would never be able to bear children. So they're both ecstatic when Mary gives birth to little Colin Campbell on September 27, 1999.
Colin was a perfect baby. He slept through the night at 6 weeks old. He traveled well everywhere.
Shortly after the birth, Mary returns to her job as a bond trader, and Colin starts daycare. But when Colin is around 3 months old, Mary and John receive a troubling phone call.
I got a call from daycare. He didn't appear to be feeling well, and by that evening, he would quickly spike a fever.
Runny nose, runny eyes, had problems breathing a bit, coughing.
Concerned, the Campbells take Colin to the pediatrician the following morning, but the doctor's convinced that his respiratory problems are perfectly normal.
His pediatrician gave him a physical, checked the ears, listened to his lungs, and told us that he sounded junky. He appeared to have some sort of sinus infection. She would put him on an antibiotic.
He would be sent home, and typically it's, 7 or 10 days after that, he would be better.
Colin returns home and, sure enough, begins to recover a few days later, but not for long.
He spikes another fever, same symptoms as before, runny nose, cough. We took him again to his pediatrician's office. Again, listening to his lungs, he has that same junky sound. So, again, an antibiotic, and home we went.
Colin recovers a second time, but once again the symptoms return. Whatever is happening, it appears to be chronic.
He would be well, and then it would seem like 2 weeks later, he would be sick again.
It became a pattern for us.
Same symptoms, runny nose, coughing, chest, exactly the same.
Colin's coughing and junky sound persists for months. Then, one night, his breathing becomes even more labored than usual.
When Colin was 8 months old, he again had become very sick. And that night, his fever was so bad that I was just frantic. It felt different to me as a mom. He just seemed to be going downhill so fast, I didn't know what to do.
Mary and John rush Colin back to the pediatrician.
They seemed a little shocked to see us. We didn't have an appointment, but took one look at him and knew, there was something seriously wrong.
Observing Colin's labored breathing, the pediatrician suspects he might have asthma. She administers an inhaled steroid and sends the Campbells to the closest hospital for an X-ray to check for pneumonia.
We were only hoping that, if pneumonia was in fact what he had, that's something that they could treat.
The next day, the Campbells receive the results of the X-ray. Colin does indeed have pneumonia, which can be treated. But then the doctor mentions something else that catches Mary off guard.
The pediatrician called to say that they had found an air pocket on his lung, that it wasn't anything to be concerned about. Sometimes an occurrence after a child like himself had had pneumonia.
I had no idea what an air pocket was. She wasn't concerned about it. I wasn't concerned about it.
Colin's pneumonia eventually clears up, but he continues to have difficulty breathing. After another consultation with the pediatrician, the Campbells decide to have him treated with a nebulizer.
It's a machine that has a mask that you put over his face, put in albuterol and another medicine called Xopenex.
It would open up his passage and help him breathe better, and those treatments helped.
Typically what would happen, he would have the treatment 3 to 4 times a day for 5 days. We never went anywhere without this machine.
But even with the nebulizer, Colin's respiratory ailments continue.
He would go down in flames in a hurry. So it wasn't like we had 2 or 3 days where he was starting to get sick. He would get sick and it'd be overnight, spike of fever.
He seemed to have one infection, and before it was gone, he'd have another one.
They had been treating him for asthma, and his condition did not get better at all.
I knew it wasn't asthma because the treatments weren't helping the way they should have been helping him. Something else was wrong.
Mary and John begin to worry that Colin's chronic symptoms could be a sign of a larger problem.
You start questioning yourself, thinking, this just doesn't seem right. It's too many trips, too many visits, always the same symptoms. My worst fear was that something would make him so sick he would die.
Toddler Colin Campbell has suffered mysterious chronic respiratory infections and shortness of breath his whole life. Then, one summer night, Mom Mary Campbell comes home late from a meeting and is horrified by what she finds.
Walked in the door. John is in our bedroom with Colin on the bed, looking very concerned. And I just remember taking one look at him and his little chest is collapsing.
Colin's nebulizer treatments, which helped his breathing in the past, are no longer working.
His breathing had not got any better, and he was very sickly looking, very pale.
And he can hardly talk to me because his breathing is so labored. I said, let's go. We're taking him to the emergency room right now. We came in to the emergency room and it was crowded, and they immediately took us back.
They immediately gave him another treatment, and it helped a little bit, not a lot.
The Campbells worry that time is running out for little Colin. Later that night, an attending physician examines him and orders chest x-rays. Mary and John are hopeful this new test will give some indication of what's been afflicting their son. The results are nothing short of startling.
The physician said to me and to John that he had not had his medical dictionary out in 20 years. He had put the film up and you could see the shadow on his lung. And he said, if your son was 40 years old or 50 years old, I would tell you he has emphysema. But he's a 2.5-year-old little boy, and I do not know what's wrong with your son.
Mary and John are stunned by the news.
I have goosebumps right now. It's, my heart dropped. You know, at that point, we were just, I think, both terrified that, you know, he's not getting better, he's getting worse. And now they don't know what's wrong.
The dark spot is a complete mystery. Seeking the advice of a specialist, the attending physician emails the x-rays to the Detroit Medical Center Children's Hospital.
The doctor consulted with a radiologist at Children's Hospital, and within, a half hour, he said, you need to get this child here now.
The Campbell family speeds the entire 60 miles to the hospital, knowing Colin's every breath could be his last.
I was praying all the way down there, crying and hysterical and afraid that something was so seriously wrong that maybe this time he wasn't going to get better.
A team of doctors is waiting for Colin when they arrive.
It seemed like 10 or 12 doctors bombarding us with questions. What did he eat? Did he eat a peanut?
How's his health been? How sick has he been?
Did he have M&Ms? Has he inhaled something?
How often is he sick? How often is he well?
At this point, I think we were both just in such a state of disbelief that we were here, trying to remember something that would give them some cause for him to be there. And through all the questioning and knowing there was nothing we could do to fix it.
One of the doctors asked one other question, and that was, has there ever been a x-ray taken of Colin younger? And it was, yes, there was.
We got right on the phone and called the hospital and requested that it be made ready.
As soon as the earlier x-ray arrives, the doctors review it side by side with the new one. They are stunned by what they see. The air pocket they found in 8-month-old Colin is in exactly the same location as the black spot they see now. The team immediately calls in pediatric surgeon Dr. Paul Stockman.
This child had symptoms of common problems, but did not have one of these common diagnoses. What went through our mind as pediatric surgeons is that could this be a birth defect or other physical problem, such as a tumor or a mass or a cyst?
Dr. Stockman orders a CT scan for Colin to get a better look at the abnormality on his right lung.
The CT scan has the ability to define abnormalities in the lung with greater detail. They can also help us decide what's the best way to approach these lesions.
I just remember thinking at that point, now we'll find out what's going on. Now we'll get an answer.
Toddler Colin Campbell's life is hanging by a thread. He is unable to breathe on his own, and his x-rays show a dark mass on his right lung. Dr. Paul Stockman has ordered a CT scan of Colin's chest to see if the three-dimensional image can show something the x-ray is missing.
For our purposes as pediatric surgeons, a CT scan of the chest is probably the best test that we can do.
When the results come back, Dr. Stockman knows right away what's going on. This is no ordinary lung problem.
Colin's symptoms were due to an anomaly of the right lung, a cystic adenomatoid malformation, or CCAM.
CCAM, or congenital cystic adenomatoid malformation, is a birth defect in which a portion of lung tissue develops abnormally and becomes filled with cysts, or small fluid-filled cavities. When CCAMs develop, they can compress the good lung tissue and the heart, causing infections, breathing problems, and sometimes heart failure. It's not known what causes part of the lung to develop abnormally like this, but there are 400 to 500 reported cases in the U.S. each year.
He basically said to us that left untreated, it would always be an issue, and that, you know, these are kids that you read about in the paper, you know, you hear on TV, a young man dropped dead on a basketball court. Basically, he would be a walking time bomb.
Dr. Stockman tells the Campbells that Colin needs to have the abnormal portion of his lung removed immediately. Colin is prepped for surgery and scheduled to go into the next available OR.
We said a prayer around his bed, and I just remember sobbing and sending him off with them and waiting.
The operation is done through an incision in the mid-portion of the side and back of the chest. We make an incision between the ribs and spread the ribs apart.
In the OR, Dr. Stockman finally sees the C-cam with his own eyes.
And when we opened the chest between the ribs, the lesion, the tumor, more or less ballooned out of the incision because it was under such a high tension.
The C-cam is larger than Stockman anticipated, and the delicate operation takes much longer than anyone thought. When he's done, he emerges from the OR tired, but with some good news.
He had come and said that he had responded, very well to the surgery, that it had taken a little bit longer because it was a little bit bigger than they expected.
The size of the abnormality in Colin's right chest was approximately the size of an orange. And if you can imagine, in a 2-year-old, that's actually a fairly significant percentage of the total volume of the right chest.
After 2 weeks of recovery, Colin is finally sent home. The Campbells are relieved that the ordeal is finally over, but they can't help but wonder why it took so long to diagnose their son's condition.
But in a year, we see approximately 3 to 4 cases of cystic adenomatoid malformation. It is quite rare. It has very common signs and symptoms that are similar to other more common problems such as asthma or an aspirated foreign body or a pneumonia.
Today, Colin is as healthy and active as any 7-year-old.
He's a very bright child. He loves sports. He loves reading.
This experience was my worst nightmare. I think it's made me a better mom. We certainly don't take anything for granted anymore.
He even said, a little while ago, I've only been to the doctors once or twice this year. It's like, perfect.
Colin Campbell's symptoms were so life-threatening they demanded attention. Laura McCann's were so embarrassing that she did everything she could to keep them a secret. In 2004, Laura is a successful entrepreneur and an extremely active mother of 2.
I was the single mom and, was pretty much working 80-hour weeks back then.
She's a very social person. She is the personality type that you'd call unstoppable.
But in June 2004, on a trip to Paris for a wedding, Laura's boundless energy comes to an abrupt halt.
While I was at the wedding, we ate very well, one of these 8-course meals, and it was just a beautiful setting. But a couple days after, I got very, very sick. Stomach problems and cramping and sort of Montezuma's revenge.
Laura calls her doctor in the States, who advises her that it's probably just a bug and prescribes an antibiotic.
I didn't really think anything of it at that time. I just thought I ate bad French food or an evil mushroom or something.
But by the time Laura gets back to the States, she seems to be getting worse.
It didn't really alarm me because I worked at home a lot, and if you don't feel well, you just get up and you're 2 seconds away from the closest bathroom.
Then, one day, while she's walking in New York City, something awful happens.
I was at the beginning of my block, and I thought, oh my God, what just happened? I just feel like my stomach's gurgling, and you know when you have to go to the bathroom and it's urgent. And as I'm walking down the street, I can feel like I'm losing control over my bowels.
Laura rushes home.
And as I walk through the apartment, it's just like my whole body lets go. And I'm like, oh my God, this is mortifying. But nobody was there, so I thought this is just something that happened.
Laura tries to forget about the accident, but after another close call the same week, she decides to schedule an appointment with her doctor.
She said, well, we should take a stool sample and see if something's going on. So she said she'd run all the tests. They came back and she said, there's nothing wrong. Ran all the tests, everything's fine.
But Laura knows what she's experiencing can't be normal. The next step, she decides, is to consult a nutritionist.
The biggest changes I made is I definitely cut out anything with garlic, stayed away from spicy foods or ethnic foods.
Laura is religious about her diet for the next 4 months, but nothing seems to change. Then, in January, 7 months since this all started, she gets some scary news.
My mother found out that both her brother and her mother had colon cancer.
And that's where I think we began to say, could it be something major that they've overlooked or they haven't done the right tests for?
And she sent an email to everyone in the family, everybody needs to get tested for colon cancer and get a colonoscopy.
A colonoscopy is a procedure that allows a doctor to thoroughly examine a person's colon through the use of a small, lighted camera. Laura gets a referral immediately for a gastroenterologist and has the procedure within the week.
They says, oh, you're perfectly healthy, you have the colon of a 3-year-old. So I said to him, well, what should I do? He told me that I should take one of those commonly taken anti-diarrheal pills that you can get at any drugstore and take as many as I wanted, as often as I wanted.
Laura follows the doctor's directions and is soon taking 5 or 6 doses of an anti-diarrheal medicine a day. Though the symptoms do not clear up entirely, the medicine works well enough to allow her to have a social life again. In July 2005, she begins dating David Ramsey.
I met Laura through internet dating. We met for drinks, went to dinner, went to jazz club.
Everything seems normal to David. What he doesn't know is that Laura has done a lot of work to ensure the appearance of normalcy.
The goal was to know everywhere there's a bathroom and map it out so that you have complete control.
But David doesn't notice anything out of the ordinary, and their romance takes off. After dating for 2 months, they decide to take a trip to Paris together, and it is there that Laura's worst fear becomes a reality.
We went to a very, fine restaurant and got all dressed up, and I thought, dinner, I really would love to go back to the hotel or be somewhere where there's a bathroom. And he goes, let's go take a walk on the bridge, the bridge that was in that movie.
So we were walking up the river, bridge by bridge, trying to pick out the right one.
Well, as we're getting to the bridge, I get this feeling, and it was like the worst I've ever felt. It was like your whole body just feels like a volcano, and your head just starts to pound, and I went, oh no, oh no, oh no, oh no. And I had completely lost control of my bowels. And I just stood there, and I was in complete shock. And I thought, oh my God, what am I gonna do?
I didn't hear anything, but I could unfortunately see something splattered on her lower leg, so I immediately knew what had taken place.
I'm just filthy. I'm in an evening dress, in high heels, and I was like, this is it. This is like the worst thing that could have ever happened to me, and it just happened.
Laura McCann has been suffering from uncontrollable diarrhea for 1.5 years. She is having as many as 5 attacks a day. And no doctor can tell her why.
Her sense of well-being was dramatically altered. I watched her eyes get hollow and her spark go out and get very, very listless and depressed, and
I actually bought a bag of adult diapers. The minute you put on your first adult diaper, there's this visual that you get of yourself in the mirror, and you say, okay, this is it. I have to solve this problem now, or I could be spending the rest of my life wearing one of these.
Laura quickly locates a gastrointestinal specialist in the Bronx and makes an appointment. But then she realizes that this trip, which 3 years ago would have seemed like nothing, is a major journey.
And I got in my car, and I just actually sat there for 5 minutes. And I started to cry. And I'm sitting there and going, I can't believe it. I want to go to the doctor, and I want to get somebody to help me, but I can't travel for 2 hours and deal with the stress of that. I can't.
She saw how restrictive her life was becoming because of this. This was getting to the point where it was ridiculous and something had to change.
David insists that Laura get some help, and if it has to be close by, so be it.
I went on a search engine and I put in diarrhea, New Jersey. Very odd search. And I read this article and I went, oh my God, this is exactly what my symptoms are.
Also mentioned in the article is a gastroenterologist, Dr. Saad Haba. And to Laura's delight, his office is only minutes away from her home.
When Laura came to me in the office, it was very clear to me that she was under a lot of distress. Her symptoms were primarily multiple bowel movements. She had episodes of urgency and at times incontinence. Clearly this was very socially embarrassing. Diarrhea was controlling her life.
He waited till I was done, and then he said, well, I'm very glad you're here because I'm going to make sure that whatever it is, you have your life back.
Dr. Haba has a hunch he knows what's going on, but first he needs to rule out other conditions, such as cancer, colitis, Crohn's disease, and parasites.
I explained to her that we had to go through the laundry of medical diagnostic tests and x-rays and lab work.
Over the next 6 weeks, while the lab work is being run, Laura can take nothing to alleviate her symptoms. She is now a virtual shut-in.
While we were going through the testing, I kept worrying, what if we go through all this and there is no answer and it isn't this, and then what?
One by one, the test results arrive, and all of them come back negative. While this would signify a dead end for most doctors, for Dr. Haba, it is a light at the end of the tunnel.
I said to her that I think I know what's going on.
Dr. Haba then begins running tests on a part of Laura's body that no other doctor has ever mentioned, her gallbladder.
The function of the gallbladder is basically to store bile, which is important for digestion.
The tests will tell Haba if Laura's gallbladder is secreting the proper amount of bile. He does this by injecting her with a special dye. Using a camera scan, he is then able to observe how the gallbladder is functioning. 2 days later, Dr. Haba has the results back.
In Laura's case, the gallbladder was abnormal. I explained to her that this was a syndrome that I had studied and taken interest in, the relationship of chronic diarrhea with dysfunctional gallbladder. And she said, so what is this called? And I said, well, it actually bears my name. I told her that she had the Haba syndrome.
Haba syndrome is a condition where the gallbladder functions abnormally, resulting in a disproportionate amount of bile in the digestive tract. Too much bile in the intestines causes severe diarrhea.
Haba syndrome is quite treatable. We basically change the constitution of the bile to avoid the effect that will induce diarrhea.
Dr. Haba prescribes Cholesvolam, a drug usually used to combat high cholesterol. It binds with the acid in the bile and neutralizes it, reducing its harmful effects on the intestines.
And he said, here's what we're going to do. We're going to start you on this drug, and you take it before every meal. Literally, on the second day, I didn't have the problem anymore.
It was pretty amazing that after months and months of searching for an answer, one simple prescription was able to take care of everything that quickly.
So I could see radical change in how she felt about herself, about her body, and about her life.
She's now leading a normal life. She forgot what normal was all about.
Now 42 and married to David, Laura can resume her hectic lifestyle and get back to normal, both at home and at work. But she'll never forget how her world was turned upside down by this embarrassing syndrome.
Diarrhea is a personal matter. It is intimidating. It is embarrassing. It is even embarrassing to be discussed with their own doctor.
Dr. Haba estimates that up to 3 million people in the U.S. might be suffering from Haba syndrome, most of whom do not know it.
It's only been 5 years since I described the syndrome. Most of the physicians are unaware of the diagnosis. They are at a loss. So they tell the patients to learn to live with it.
You know, what really struck me is that there's other people like me out there, and they might not have the information that I have. So I'd rather share my story than, keep it to myself. I hope it can help one person. Really made a difference for me.
Because of the nature of Laura's symptoms, she was too embarrassed to talk to anybody about them. Quietta Davis told anyone who would listen about her problems, but doctors largely ignored her. Quietta, known to her family as Q, is an active 34-year-old when she decides to leave her home state of Michigan to go to college and get a teaching degree.
I was a very busy person. I would walk every day for exercise. I did a lot of studying, and I was just always on the go.
But in August 2001, her junior year in college, Quietta has a frightening accident alone in her living room.
I crocheted all the time. I always had a project going, either 1 or 2 projects at any given time. I had went to the kitchen to get a glass of water, and I didn't know that the crocheting had fallen to the floor, and it was standing straight up. And I was running across the living room, and suddenly I stepped on it, and the hook punctured my foot. My whole body went numb from both legs all the way up to my shoulders. It kind of scared me because I knew that something was wrong and something was going on inside of my body.
Quietta Davis is terrified. She's just stepped on a crochet needle, puncturing her foot, and in a matter of seconds, her whole body has gone numb.
It was a total shock to me. I knocked on the wall to my apartment.
A neighbor hears Quietta's cries and calls an ambulance. At the ER, doctors x-ray Q's foot, but find no nerve or bone damage. The doctor cleans out the wound and sends her home on crutches.
And he told me twice a day that I should use saline solution to keep it clean and dry.
A week later, Q is walking on her own again, but she feels different than before.
I noticed I would have a harder time getting up in the morning for school and for work.
She called me. She was very concerned. She says, something's happening to me. She said, I'm just wore out.
4 months later, Q wakes up one morning and things take a turn for the worse.
My whole body had gone numb, just like it had the time when I punctured my foot with the crochet hook.
Quietta is so scared, she goes to the hospital 3 times over the next few days, even though she has no health insurance.
I said, my body keeps going numb. I said that the fatigue was just almost unbearable. They checked my blood pressure, which was elevated, and they said that my heart rate was a little high, and they felt that it was anxiety. They gave me 2 Xanax, and they sent me home.
My mother, we talked daily. She would call, and she would say, Quietta went to, the emergency room today. And in, the back of my mind, I'm thinking, she's homesick, she's missing everybody, so she just needs to see my mother.
But Quietta does not recover from the weakness and numbness, and functioning on a day-to-day basis becomes unbearable.
I felt like I couldn't hardly walk because I couldn't stand up straight. And so I had to use a walker just in order to get around. It felt horrible because I knew that something was wrong, and it wasn't being taken seriously. I knew the reason why was because I had no insurance and no means of paying. I just had that uncertainty as to whether or not I would live.
Q is so desperate, this fiercely independent woman reaches out to her family for help.
She said, Mama, you need to come down here. She says, I'm really sick. Oh, when I saw her for the first time, I could see that she was sick. I could tell that she had lost some weight, and she was pale looking.
Q and her mother then make a difficult decision. Q will drop out of school, and they will return to the family's home in Michigan, where she can apply for emergency Medicaid.
It was kind of sad for me to have to leave so suddenly.
After a 3-day drive back to Michigan, Q finally arrives at her mother's home.
I was at my mother's house when they pulled into the driveway. My first impression upon seeing her was, my goodness, she has aged like 10 years. Okay, something really is going on. She is sick.
Once her emergency Medicaid comes through, Q finds a new doctor. He runs a whole new battery of tests, and these tests reveal something new.
He said that the ANA was positive, and he said that meant that I had lupus.
Lupus is a widespread and chronic autoimmune disease that, for unknown reasons, causes the immune system to attack the body's own tissue and organs, including the joints, kidneys, lungs, skin, and other body parts. Lupus is also 3 times more common in African American women than in Caucasian women.
I was happy with the diagnosis because finally it was proven that something was wrong.
Armed with a lupus diagnosis, Q starts to work with a rheumatologist to relieve her symptoms.
He prescribed a medicine called Plaquenil and a few other medications to treat different symptoms, and I began to feel better immediately. My health had begun to improve, and I was told that the lupus had gone into remission. So most of 2003 and all of 2004, I felt fine.
Q continues her lupus treatments into 2005, but to her dismay, the old symptoms suddenly reemerge.
I started having the problems with numbness in my face. I had numbness in my feet. I was still fatigued.
Something is not adding up. Q and her family begin to wonder if lupus was the correct diagnosis after all.
I was beginning to wonder, what is this, and how much longer am I going to have my sister?
But nothing can prepare Q or her family for what would happen next.
When I woke up, my vision seemed to be a little blurry. So I covered my left eye, and I could see fine out of my right eye. Then I covered my right eye, but I couldn't see anything. The first thing I thought was, why did I go blind?
Q Davis has spent the last 4 years suffering from debilitating fatigue and numbness throughout her body. Though she is being treated for lupus, her symptoms continue to get worse. Then, one morning, she wakes up with the scariest symptom yet.
Q called me. Ma, she says, I can't see out of my one eye. I said, what?
Ruth rushes her daughter to the ER.
They brought in a neurologist, and the neurologist examined my eyes, and he told me I had a condition called optic neuritis.
Optic neuritis is an inflammation of the optic or visual nerve that connects the eye to the brain.
And so he told me I needed to see a neurologist.
Through a referral, Q finds neurologist Dr. Kenneth Bottizi.
When someone comes in with optic neuritis, we think about several different disease processes, including lupus, other inflammatory disease, also sometimes stroke, even in the young.
He did a complete neurological examination. He ordered an MRI, and he ordered a whole bunch of blood tests. He wanted to rule out lupus. Dr. Bottizi wanted to see me again in 2 weeks, but in the meantime, he prescribed steroids because he said for some reason my immune system was raging.
2 weeks later, Q returns for the test results.
The blood tests, including the inflammatory tests, were all negative. However, the MRI of the brain did show these white matter lesions. This, plus with the history of the optic neuritis, led to the conclusion that this was multiple sclerosis.
Multiple sclerosis, or MS, is a chronic degenerative disease of the nervous system. It's brought on by a gradual destruction of myelin, the fatty protective tissue that surrounds nerve cells. This degeneration occurs throughout the brain and spinal cord, leaving small damaged areas, or lesions.
Once you don't have the myelin, it's like a raw nerve. It can actually cause misfiring, shorting in the wire, and from that, then you can have the symptoms of multiple sclerosis.
It was these misfirings of the nerve cells that caused Q's numbness in her limbs, her difficulty walking, her extreme fatigue, and eventual blindness.
This time, having this diagnosis felt a lot different. I felt a huge relief.
It is unknown what causes MS, and although there is no cure, there is treatment.
When someone has an acute attack, sometimes you use anti-inflammatory medications such as prednisone or other steroids that can decrease the inflammation in the brain. But long-term, there's been 4 medicines that are approved by the FDA.
I chose to go on the medication Rebif. What it does is it slows down the progression of multiple sclerosis.
Although 400,000 people in the United States have MS, for many, getting the proper diagnosis can be a long and difficult process.
There's not one specific test to diagnose multiple sclerosis. The symptoms of multiple sclerosis are sometimes numbness, vertigo, spinning sensation. So with this, it could be other disease factors. It could be an inner ear infection, it could be viruses, pinched nerves, peripheral neuropathy. It could be a host of different things.
If left untreated, Quetta's MS could have rapidly progressed to permanent immobility or death.
The way it would kill you most of the time is because when you have it so bad, you will be less ambulatory. You might have a pneumonia, or it might kill you by having a blood clot in your legs going to your lungs.
Dr. Bottizi tells Quetta that if you have a latent autoimmune disease like MS, different traumas can trigger an attack. And suddenly, a very old injury makes sense.
By stepping on the crochet hook, he said that probably triggered it.
Today, Quetta takes life slower than she did in the past and uses her experience to teach others about MS.
It's been said that many African Americans do not have MS, but I found that to not be true. So I started a group called the Urban Multiple Sclerosis Alliance.
She still wants to finish college. That's a goal she has set, to say that I'm going to finish college.
As sisters now, I think we're closer. I'm not, taking what she says for granted anymore.
I think that the experience has changed me. Certain things now don't seem to be as important as it may have been before I was sick. I don't take anything for granted anymore.